Welcome to Vitamin B with Mohana. This is where we help you take control of your well-being. My guest today is Dr. Govind Mittal, a dermatologist, and we are going to be talking about sexual health, sexually transmitted infections and diseases, and essentially how can we gain good knowledge about it and prevent it.
The taboo created over generations.
Sexual health. Why is it important?
10 lakh curable STIs acquired by individuals between the age of 15 to 49
My God, okay.
across the world every day. So birth control pills only prevents pregnancies.
Right.
It will not prevent an STI.
If I'm only with one partner for a long time, is it still important to wear a condom?
Nobody comes with a label of an STI on their forehead. If I'm on birth control pills, I don't need to use a condom.
Before, during and after sex, how do we keep ourselves clean?
We have very few fathers talk to their sons about care of the private parts.
You have to wash yourself after having sex. It's the most fundamental, important thing.
Yes, we have to face this, that men are more adventurous.
Porn is not reality.
Definitely not.
I think everyone needs to clearly understand.
Urinary tract infections are extremely common in women who are sexually active.
Unfortunately, particularly in India, we don't have the exposure.
Your 40 drops of blood makes 1 drop of bone marrow, and 40 drops of bone marrow makes 1 drop of semen.
How do we know we have a sexually transmitted disease?
Pain while peeing, burning sensation when you're peeing, not have any symptoms and still transmit the disease. In today's Gen Z, and the educated lot, is that oral intercourse cannot transmit STIs.
A very narrow way of saying that, hey, I should be good in bed.
My popular line to my patients is, immaterial of the hole you enter, you need to be covered.
We're so shy about talking about sexual health.
Age of early sex. It hasn't changed much.
Who has more STIs today, generationally?
Carry an STI, transmit it to others without even knowing that he has an STI.
Multiple partners, you have usage of sex toys, you have group sex, you have a lot of things which are actually taking place.
The erection is triggered by stimuli that is reaching the brain. Swipe right and swipe left and sleep with someone in the next 10 minutes whom you've never met earlier. Potential to transmit this STI to their child when they are, pregnant. It's better to be safe than sorry.
So come join us and relax, sit back, and I'll see you at Vitamin B with me, Mohana. Welcome to Vitamin B, Dr. Govind. It's such a pleasure to have you here.
Thank you so much, and thank you for inviting me to be a part of this.
I think this is such an important topic we're going to be talking about. And I was sharing with you, when I talk to my friends about different topics that we should be, actually bringing on the show. Sexual health, sexually transmitted diseases came out to be one of the most important things, given so much is going on around us, right? Especially the openness today to actually, exploring sexuality as a topic itself. So thanks a lot. I think you've come and you're going to make a very, very big difference to our podcast.
Sure. I hope I'm able to create awareness through this short meeting.
Yeah, absolutely. It's interesting that a lot of men have also asked for it. So we'll try to sort of see how best we have some information for them through the conversation that we're going to have.
Why do you say interesting? A lot of men have
Because there's no openness to this. A lot of times I feel that as it is, women really are very shy. Within the friend circle, you end up talking very shyly, very coyly, which of course in today's generation has changed a lot with the Gen Zers. They're more open about it. But guys coming and talking and saying, hey, actually I want to be responsible. Actually I want to know more and take better care. I think that was pretty cool of them to do. So it's great to see that people are more open to learning about this and taking charge, because would you agree that in India we're so shy about talking about sexual health, right?
It's all about the taboo created over generations. It was like, if you even uttered the word sex and people would just raise eyes and people would look around and shh, and that kind of a thing. But it's really nice to see how things have changed over time. People are more open about it. For example, even if you say how people look at relationships.
Yeah.
I'm saying somewhere it all boils down to sex. But if you start off even with relationships, I don't think it was cool, or it was even okay as a teenager to tell my parents that I have a girlfriend, or just to say that you have a partner or anything like that. I don't think that was considered okay or considered cool 20 years back. But I've seen parents today, and they're like very open about their kids' relationships, and the current day young adults or teenagers. They share about these details, and they find it comfortable to share about these details to their parents,
right? Yeah.
Which is very important. I feel it's better discussed openly, and you learn things the right way, rather than you know learn the wrong stuff by googling something or asking your peers who may not know anything better than you.
Totally. I think there are two sets. One, I still have friends, okay, and they're like, no, I'm not okay if my child basically has sex in the house, okay, but they're open to talking, but they are traditional that way. They expect respect. I think they come from that angle, right?
It's perfectly fine.
Yeah. And then they have others who basically say, you know what, I don't want my children to be caught in a movie theater. I think it's better that they are home or in a safer place where they're going to explore their sexuality, right? So there are these moving dimensions.
I think we need to give it to them. I would say each family has its own values and boundaries, and I think we need to respect that. Everyone is brought up in a different way, and every parent may give a certain amount of freedom to his or her child. But I think we have moved from a society which used to talk about, should we have premarital sex? Is premarital sex okay? To a generation that says, hey, premarital sex is okay as long as it is safe.
True.
So I think that change is a welcome change, rather than people trying to do it in a very hush manner. If you actually look at studies and incidences of, say, age of early sex, it hasn't changed much. Although
that is the truth, right? Because we think that earlier people didn't, but they were hiding and doing it, and they just didn't talk about it. It's more risk actually, right, with what they were doing.
And it was under the bracket of marriage for me, because the age of marriage has changed. If you go back to a century, just a couple of days back, I was reading in the newspaper where they talked that it was the marriageable age in colonial India was at some point in time in the late 1800s. The marriageable age for women was 11.
Oh yeah, okay.
And there were reports of death at the first sexual intercourse, and that's painful. Women bleeding to death, or they've got married to someone who's 30 years old, 35 years old. All those evils in the society that existed back then. Multiple wives and child marriages. So if you actually look at the age of first intercourse, may not have changed much. It's just the openness around it has changed.
Got it. That's wonderful to know, and it's a great generation that we are actually talking about as well. So just on that note, right, I'm very curious to understand if there is any sort of way to describe sexual health. Why is it important, and what is it all about?
Sexual health, to define, now this is not out of a textbook, but this is how I look at it. Sexual health first starts from sexual hygiene. The ability to enjoy safe sex to one's satisfaction as per one's age.
Interesting.
Okay. And prevention of STIs, and all of this in sync with a healthy body and mind. So for me, all these points encompass sexual health.
That's wonderful, right? Because that's a very holistic way of looking at it. Typically, I would have thought that sexual health is about, a very narrow way of saying that, hey, I should be good in bed, right? It's so much beyond that, right? Because that's just the popular sentiment, right?
That's just a part of it.
Yeah, absolutely. So what is okay? Let's do this, right? I want to talk about STIs, STDs, but maybe we hold off for a minute. what are the common myths or misconceptions on sex or sexual health? Anything that you sort of come across?
Wow, so we can go hard and hard
Is
about
it?
myths, because everyone has their own perception. See,
Yeah.
what is a myth? Myth is a perception which is not true.
Sure.
And who can change perception? Perceptions is something very individual. So I can have some perception about a particular topic based on my past experiences or based on what I have read or I have heard or I have seen. So that's a myth. So topics such as sex, there can be a number of myths. But I think the most common myth in today's Gen Z and the educated lot is that oral intercourse cannot transmit STIs.
Wow. So oral sex can transmit STDs and STIs. Okay. Yeah.
Hell yes. I mean to say, people will like, so as a venereologist, so people come into the clinic and, I was like, have you had multiple partners? And they would say, yes, but I've been safe with all of them. I've used a condom, every time. I said, that's wonderful. So do you practice oral sex? I said, yes. And then they're like, were you wearing a condom? No. Am I supposed to wear a condom?
Yeah.
That would be, I was like, you have not practiced safe sex.
Yeah.
So you need to be safe all the time. So my popular line to my patients is, immaterial of the hole you enter, you need to be covered.
Interesting.
So just to put it very candidly to
of course.
them,
I think it's very helpful for all of us to know, and we're going to have some very candid conversation today, right? But it's very essential because a lot of people are sexually active and they need to know this. What else? What is another myth?
Okay, so the other myth is, if I'm on birth control pills, I don't need to use a condom.
Okay.
So birth control pills only prevents pregnancies.
Right.
It will not prevent an STI.
Nice. Yeah.
So that's one myth. What else? This is more than a myth, it's a belief. My partner is the safe partner.
Yeah, I was going to ask that. If I'm only with one partner for a long time, is it still important to wear a condom?
Obviously, this depends on multiple things in the sense that everyone may have a past. Okay, so just because you've been with a partner, say for 6 months, does the 6 months period erase the fact that your partner had a past?
Okay.
Or you had a past?
Okay.
Nobody comes with a label of an STI on their forehead.
Yeah.
Or nobody, when they're transmitting a disease, has visible symptoms of STI. So something very, it's like the early phase of COVID, before now many people understand disease better after COVID. So there's this period of the initial 2-3 days before you have symptoms where you can still transmit the disease.
Oh, okay.
And even after your symptoms have settled down, there is a period where you can still transmit the disease. There may be a viral shedding phase, So that doesn't mean, same way for STIs, this phase may be long and there may be an asymptomatic phase where you could not have any symptoms or any visible symptoms and still transmit the disease.
Sure.
So I'm totally against the fact that just because you've been with the person for long, it's one fine day safe to say, oh, I'm going to stop wearing a condom, kind of a thing.
Okay, so wow, so that's a lot of things to digest, right? Because I think most people make these common mistakes, I suppose, and it's really helpful to know some of the misconceptions. Great. And when we go back to your definition of sexual health, right, a holistic definition that you shared, I want to start with what you first talked about, which is sexual hygiene or personal hygiene, right? I'm telling you, women don't like it. They find guys, many women, we talk about it, I've read about it, that they feel that men don't take good, hygienic care of themselves. What should we be thinking of from a man's angle and a woman's angle before, during, and after sex? How do we keep ourselves clean?
Wow, I'm so happy that you asked this question because I've always wanted to talk to men about sexual hygiene, because whenever they come to clinic, more than talking to them about you have this disease, you have that disease, like these are some of the hygiene things that you should be doing to take better care of yourself. Because one problem we've had as a society is we have very few fathers
Yeah.
talk to their sons about care of their private parts. I feel it should be okay for fathers or older brothers to talk about what is sexual hygiene, to their younger siblings or to their children for that matter. So if I were to spell it out, the first thing, even before,
and we'll start with men. Okay.
And even before I enter pre-intercourse or post-intercourse, I'm talking about daily
hygiene.
Daily hygiene for men is, especially for most men that we know, if we see, who are not circumcised for religious reasons or who are otherwise not circumcised for medical reasons. So for most men who are not circumcised, they should pull back their foreskin or prepuce on a daily basis and clean it. Okay. So this whole cavity or a place, it's a dead space or an empty space between the head of the penis or the glans penis. The skin folds back. And so it's a dark, moist, warm place. And your secretions can keep getting accumulated. Okay. And they form this liquid called smegma. Smegma.
Smegma. Okay.
Yeah, that's what it's called. So it is this oily white substance which just keeps accumulating. It's nothing but dry dead skin and secretions that accumulate. Sometimes so much so that it forms like a layer a couple of millimeters and people haven't washed it.
Oh,
okay. So just because they're not aware that they should pull back their foreskin on a daily basis, it is okay to wash it. It's okay to apply soap.
Okay.
And clean it. It's perfectly okay to do that. That's one thing. The minute I say soap, there's one set of people who say, "Can I pour Dettol on it?" And I say, "No."
Just normally how you wash the rest of your body, please do.
Yes. So they're the set of patients who would.
But it tells you how you think about a certain body organ, mindset towards it, right?
There's a certain set of people who would just indulge in an act, indulge in sexual activity, and they're like, "Oh, I didn't use a condom. I may have germs, so let me just go and pour some Dettol," and they burn.
Oh God! Okay.
They burn their skin, and then they come to me in a bad shape, and
okay.
So, I have nothing against Dettol or Savlon, but guys, you don't pour it over your organ. No, not over your scrotum, not over your penis.
Yeah. Okay. Great. So for daily sexual health, that's great. So what do partners need to do before sex, during sex, and after sex from a personal hygiene perspective?
Okay, so I think it's always preferable to have a shower or a quick bath before intercourse, or at least wash yourself before intercourse. I think that's the least you can do. That's as far as your sexual organs are concerned. And for men and women, otherwise, avoid garlic, avoid garlic and avoid onions.
Oh, from a breadth perspective. Okay, got it.
But coming back to the more serious stuff, serious stuff, I would say that yes, wash.
Yeah.
And I think in today's day and age, be prepared that you should be wearing a condom or protection. Now, there are two ways of looking at it. One, you're a married couple, and you are a monogamous couple. You have a single partner. So you're not really worried about an STI. You're worried about an unplanned pregnancy.
Got it. Okay.
So for those reasons, I'm sure you would be wanting to wear a condom, and you can do your calculation with respect to the safe days and the unsafe days and so on and so forth. But keep a condom handy. But what I'm really worried about is the generation who's not wearing the condom, despite the fact that they are in a potential polygamous relationship. And what do I mean by potential polygamous relationship is that you may have multiple partners over 2 or 3 years. You may have a girlfriend or a boyfriend every 3 months.
Or you basically may suddenly meet someone. And that's
one
happening.
night stands. Yeah.
You have one night stands, exactly. So in that scenario also is applicable.
So definitely make sure you keep your protection handy. In fact, many people who know that they should be wearing a condom but did not use a condom, they're like, it happened in the heat of the moment.
Yeah.
They're like, I didn't have one. And this was just yesterday. And I was telling this patient of mine, I was like, dude, I think you need to be a little more careful.
Yeah.
And if you feel that you're a person who's potentially going to have one night stands, just keep a condom in your wallet all the time.
Yeah.
And then he says, sir, ab to Zepto pe milta hai, 10 minute mein aa jayega.
But the point is, please take it then, right?
Yeah, I mean, exactly. That's exactly my point. I would say this must be a selling point for Zepto and Blinkit. They can actually make an advertisement. You need it, you have it. 10 minutes.
Yeah. They did it. Actually, Blinkit has done it in the past as well. So they literally used a condom for this, and I think it's very, very
it's
important.
Progressive and it's very important. And I think such are the times where you actually can, use the services of something that you really need in 10 minutes.
So during the act of sex or preparing for it, have a condom. Before that, please try to keep yourself clean, wash yourself. If not a bath, at least just wash yourself.
Yes.
And after sex,
and again, during sex, if you're a person who's going to use sex toys or props or whatever, make sure all of them are clean. Even if something's fresh out of a cover, you may just want to wash it with a mild soap. Check if they're not leaching any color and the parts are not broken, stuff like that. Also, people who are using lubes and jellies, you may sometimes, especially those with sensitive skin, may want to just kind of patch test it, just apply it and see it's not causing burning sensation, irritation. Because I mean, so you've planned for this whole, sexual episode with your partner, and you don't want it to end up in some kind of an anticlimax, where you're having burning sensation or you're having an allergic reaction. Like some men, they're using this stay long or extra long. So I had this call from one of my friends after his first night, and it's like, my friends got me this condom which said, extra long and prolonged duration kind of a thing. And after I wore it, I lost my erection and I was not able to complete the act.
Oh my God. So there are chemicals that...
Yeah, so that's what it's supposed to do. An extra long...
and it's the opposite thing that happened, is it?
So basically, it's supposed to decrease the intensity of sensation so that you can prolong the period of intercourse.
So it got exaggerated.
Yeah, so it's going to kind of anesthetize your organ.
Oh, okay.
So imagine if you just anesthetize your organ, you're not feeling anything.
Got it.
So you will not maintain an aroused state.
Yeah. Okay.
So these kind of things.
The real cases.
Yeah, these are real cases, and it does happen. So I would say, you should be careful about what you're using.
Sure.
So that your planned moment doesn't end up in anticlimax.
Yeah, sure.
I would say keep it simple before you try to explore everything on the first time. Keep it simple, and then you learn on the go.
Yeah, this is very helpful. And then post-sex?
Post-sex, it's very important to wash.
Yeah.
I've had enough number of patients, especially a little bit of the old school thought or slightly maybe the previous generation, where it was okay for them to just sleep off after sex and not wash, which, didn't sound very cool to me. So I tell all my patients, please wash after intercourse, both the man and the woman or whoever your partners are. So both should wash after intercourse. You're washing off the excess secretions. You're not giving time for any of the bacteria to, overgrow and cause irritation. And even if you've used a condom or say a spermicidal jelly or a lubricant, all of that you have to wash off, because you don't want that sticking around in your private parts. So,
and does that lead to a lot of other types of problems?
Sometimes, I mean to say flavored condoms. Okay. Now, flavored condoms are ideally designed for oral sex. So if someone is using flavored condoms for anal sex and vaginal sex, and those fancy flavors and colors may potentially cause an irritation in the vagina or the anus kind of a thing. So you don't want that.
Okay.
So first of all, you shouldn't be using a flavored condom down there. Or even if you used, at least the least you can do is wash off. Okay. So again, you want to wash off the lubricant, the jelly, and many of these things are designed to please the senses. So there are a lot of smell involved, fragrances involved, and fragrances in the form of applications are not always
the best.
The best. I would say it can irritate the skin.
You have to wash yourself after having sex. It's the most fundamental, important thing to do.
Yes.
Even if you're lazy. Right?
Yes, even if you're lazy.
Yeah, okay. So before, during, and after sex is very clear. They sound very simple. I wonder why we didn't know about it. And
one more thing. Use a mouthwash, brush your teeth if you've indulged in oral sex. Obviously, wash the anal area if you've indulged in anal sex. Definitely better to urinate after sex. You're flushing out the bacteria that
and this
may
is
have.
For both men and women?
Why not? I'm saying definitely more for women.
Yeah.
The reason being that the urethra. Okay, urethra in men is definitely anatomically longer. So the urethra is about, say, 10 to 15 centimeter long, whereas in women the urethra is about 4 centimeter long.
Okay.
So if you feel that if there's any, so just look at it, picturize it, you have any pathogen or any bacteria entering from outside into the bladder, into your system, it has to travel just 4 centimeters in a woman. It has to travel 16 centimeters in a man to reach a place where it can cause infection.
It's faster for a woman to get the infection.
Definitely. So sexually active women, married women, even with a single partner, are more prone to UTIs. Urinary tract infections are extremely common in women who are sexually active, and that is why it is important for them to, or rather everyone, preferably to urinate after sex, and apart from washing that I spoke about.
No, that's super helpful. And anything else you want to talk about from a hygiene perspective before we move to another very important segment of our conversation?
Hygiene. Yeah, I as I already told you about, men should pull back their skin and wash.
Yeah.
It was very surprising that many men do not know about their own genital anatomy. For example, I came across this man in his mid-40s, married, has children, but he has a tight foreskin, so he has never ever seen the head of his penis.
Oh, okay.
So this is a condition called phimosis. So phimosis is otherwise not dangerous if someone has a very tight foreskin, which does not slide through the head at all. But obviously, you've never kind of cleaned that area. There may be secretions, and some point in later time in life, you would be more prone to some of the genital cancers, or to more infections for that matter. From times immemorial, they've noted that men who are circumcised are less prone to penile cancers than men who are not.
Oh, okay.
Okay. So, but coming back, so this chap was just not aware that, foreskin is something that can be pulled back.
Also.
That can be pulled back.
Yeah.
And should I get operated, or when should I get operated? So these are fundamental questions that need to. And someone who has a little bit of a tight skin, which slides back but is tough to pull back, so that's the more dangerous kind of tight skin people can have, and they should definitely get circumcised. The reason being that they could potentially go to the emergency room in a state of erection because they're not able to lose their erection because of the tight foreskin. Yeah, after the act. So it can be painful, and it can be you may be in a state of emergency kind
but
of.
But that's really helpful, because I think a lot of people, unfortunately, particularly in India, we don't have the exposure. No one wants to talk about these things. Thank God for the internet to that large degree, where you can at least
understand some stuff.
You can, if I have an issue, I'll just check, hey, what's wrong? And it may not be always accurate, but it's a starting point that I can get the information, right? So it's good to know that these things are present. People are experiencing these difficulties. It can be very helpful.
Yeah, but I feel help is there if you reach out. There's this famous quote from Dumbledore in
Harry Potter.
Are you a Harry Potter fan?
Yeah, I like it a lot.
Okay, cool. So in the second book, he says this: help will always be given at Hogwarts to whoever asks for it.
Yeah.
And later in the fourth book, he modifies it and says, help will always be given at Hogwarts to those who deserve it, kind of a thing.
Yeah.
So I feel there is so much help out there. People need to seek it. People are too shy.
Yeah.
People don't mind going to the medical stores and say, hey, I have an itch down there.
Yeah.
Rather than going to the doctor and just discussing it So what if the doctor needs to examine you? It is okay.
Yeah.
I'm saying we are all human and we are here to help each other.
But sometimes the fundamental problem I feel around us is that people don't even, like you said with this case, you don't even know it's a problem. You think you exist thinking it's all right, but actually it's going to lead you to so many other issues. That's why I think that has to be sort of, it's only overcome through information and knowledge, I guess, right? Yeah.
The right information.
The right information, absolutely. So let's move to, STDs, STIs. What is an STI, sexually transmitted infection, and what is a sexually transmitted disease?
The difference is a little more technical.
Yeah.
Although you have more than 30 odd STIs and STDs.
Yeah.
So STD is sexually transmitted disease where a person has a full-blown disease where there are signs and symptoms that a patient can feel and a doctor can see on examination. But an STI is an infection.
Yeah.
It may be an asymptomatic infection. Someone may have an STI, carry an STI, transmit it to others without even knowing that he has an STI and without his partner knowing that, okay, I'm having intercourse with a person who has an STI.
Sure.
So the approach towards this terminology has changed from STD to STI because we want to target not only treatment of a disease, but prevention of spread of infection.
So should we have this conversation from an STI lens?
Yeah. Makes sense.
So it's early stage itself. It's better to understand that you have some sort of an infection. Okay.
Yes. I mean, just again to bring back the example of COVID.
Yeah.
You could be COVID infected without having symptoms.
Correct. Yeah.
So I don't have the COVID-19 disease. I don't have loss of my my oxygen levels or cough or fever. So I don't have the disease.
Yeah.
But I may be COVID infected and I may still pass it on to others.
Yeah.
So that's the infection.
That's great. Yeah. So why do we typically get them? Is it only sex or other ways?
By definition, sexually transmitted infection.
That's it. Okay.
Yes. So many people who have STIs and they're like very scared and they're like, can I go back home?
Yeah.
Can I stay in the same house? Can I put my clothes for wash, in the same washing machine? Can I eat in the same plates? What if the mosquito bites me and bites my father or someone else? So will this cause transmission of disease? No. Okay. By definition, it is sexually transmitted. But definitely intimate contact or contact with the body secretions may lead to transmission, but not what all I mentioned. That wouldn't.
Yeah. So you need to be intimate with the person in order for the transmission to happen, basically.
Yes.
Okay. Great. So essentially, what's going on, doctor? Who's coming to you and for what, right? Essentially, what are the top 2 or 3 STIs that are prevalent today around us?
So you can talk about it in case of, from the point of view of numbers or point of view of severity. So if you talk about severity, everyone's scared about HIV. HIV is the, disease out there and people are scared about it. And if someone is really concerned about not getting an STI or not transmitting an STI, it is about HIV that they are
basically
concerned about. But HIV is not the only STI out there. You have other STIs such as HPV, and I think one of the most irritating and annoying disease, I would say, is HPV. Asymptomatic to start off with. It doesn't cause any pain, doesn't cause any symptoms, but just causes growths, unsightly growths of tissue, small cauliflower-like growths on the genitals, and which can grow in size and
become cancerous ultimately.
Yes.
Right?
So HPV is one of the virus which is notorious to cause cancer over the long run.
But is it only for women or men?
Both
get HPV. Yeah.
So you can get penile cancers, you can get anal cancers, especially in men who have sex with men, MSMs. So and cervical cancer, definitely.
Yeah.
But HPV has 150 odd strains. Just like your COVID had your beta strain, delta strain, same way. You have different strains.
Yeah.
Not all strains are cancer causing.
Got it.
Not all strains of HPV are genitally or sexually transmitted.
Okay, sure.
So for example, I had this patient 6 years back who had warts in the sole. He was a 9-year-old chap. And he had warts, viral warts on his sole foot. And I explained to the father that, hey, this is caused by HPV, and this needs to be treated. Next day, I see a review on my Google page. This doctor does not know anything. My son is 11 years old. He doesn't even know what is sex. How can he have HPV infection? Okay, because he's Googled about HPV. The first thing that you see about HPV is cervical cancer and sexually transmitted and stuff like that. So I was like, okay, how
but do we assume that this child had intimate contact with someone?
No.
Okay.
So that's what I said. Intimate contact, sexually transmitted HPV. Now, if I have viral warts, even me shaking hands with you can transmit. So if shaking hands is not intimate contact, any contact can
cause it.
Can spread. Or you could be walking barefoot in an area where there would be this virus. So HPV is way too common.
Understood.
I would see at least 3 to 5 patients of viral warts, simple viral warts on hands, feet every week.
So it's HIV, HPV.
Yeah, HPV, the genitally transmitted.
Genitally transfer for the meaning of this conversation.
Yes. And then we see a lot of molluscum contagiosum, which is again a very simpler STD to have. So again, I tell this to my patients when they're worried about, oh, what have I contracted kind of thing. So I tell patients, if God came in front of you and said that life में एक STD तो मिलेगा, तुम choose कर सकते हो कौन सा?
Okay. It's gonna be this.
It's gonna be this.
Oh my God. Okay.
You could choose for molluscum because yes, it can be genitally transmitted. It can be non-genitally transmitted also, like warts that I told you. But yeah, most people who are getting molluscum in their genital area.
What is molluscum?
Molluscum is a virus, a viral infection. Again, it presents as small white, pearly, or red fleshy bumps on the genitals.
Okay.
That's the worst it can do.
I've never heard of it.
Yeah.
Normally you hear of ghonnorea, syphyllus, but these are things which are coming out more now, is it?
No, they're more common.
Of course.
Common. Because you can't pop a pill for, can't pop an antibiotic and molluscum won't disappear. It's a virus that stays there. It has to be manually extracted or it has to be burnt using laser or certain applications and treatment. So that way. So whereas your gonorrhea, syphilis is still there. They are the hardcore STIs out there, which
and
everyone
people get it a lot.
Yes, definitely get it a lot. However, in practice, you don't see it as often as you see the HPV and MC because people can be asymptomatic and move around freely and transmit HPV and your molluscum. Whereas once they have gonorrhea, once they have syphilis, they will come seeking for advice because it is painful and they are peeing pus, they will have ulcers, it's painful, and they will seek medical advice and eventually get treated. They do transmit and they can have an asymptomatic phase also. So as you mentioned, gonorrhea is on the rise. The rise is again because of drug resistance. So gonorrhea is one of the bacteria that is known to be associated with antibiotic resistance. So, or people have been treated partially for some other fever or for some throat infection. And partially their gonorrhea improves, but not completely. So the symptoms keep coming back. The same goes for syphilis. In fact, I was reading WHO data, and there has been a surge of syphilis from 2016 to 2020, where they used to speak about syphilis, kind of getting extinct, because syphilis has been a disease which has been, talked about a lot in history. Famous people in history have
dying of syphilis, going mad.
Have had syphilis, and there have been a lot of studies, research on syphilis. In fact, it used to be called the great mimicker. Anyone coming with any skin disease, you could put syphilis as one of the differentials because it presents in so many different ways. So we spoke about HIV, HPV, molluscum, gonorrhea, syphilis. Then you have something called chlamydia, which is one of the most common bacterially transmitted infection in the US. You do have it in India as well. I don't get to see it way too often. Also because the ulcers are short-lived and easily treated with antibiotics. So
how do we know we have a sexually transmitted disease? Are there 2 or 3 symptoms everyone should know?
Okay, rather tough, but simple symptoms like ulcers in the genital area, pain while peeing,
Yeah.
burning sensation when you're peeing,
Yeah.
pain during an erection or intercourse.
Okay.
But before even going there, these are the symptoms that would really, concern you or bring you to the doctor.
Yeah.
Or if you have any growths or bumps in the genital area, which may not necessarily be painful. Now, for men, where direct examination is possible, all these symptoms are more relevant. For women, they have the vagina, which is a cavity, which is a tunnel.
Yeah.
So, no one apart from the gynecologist looks into it. So it's rather tough. So what are the symptoms they would feel? They may feel dyspareunia or pain while having sex.
Okay.
If there's an ulcer in the vagina.
Sure.
They may feel foul smelling discharge.
Yeah.
Okay. Abnormal discharge. Or they may, if the infection has proceeded, into the, pelvic area and cervix and uterus, then they will have pelvic inflammatory disease or PID, where they have pain abdomen and more significant symptoms. So once you have these bacterial STDs which are spreading, or even some of the viral STDs such as herpes spreading, then there will be more symptoms like fever and fatigue, like the other symptoms of a classic infection.
That's really helpful. And so if you use barrier methods like condoms, etc., right, does it stop you from getting STDs, STIs?
I think that's the best thing you have out there. Okay,
those
that's
are the best practices.
Best practices. If you want to have multiple partners, then the best way to keep yourself away from STIs is to strictly use barrier protection. But the condom cannot definitely prevent you from some of the STIs. For example, Mosullcum. Mosullcum can affect areas around in the pubic area, in the inner thigh area.
So just because you touch your bodies, you get it. You don't even have to.
So there's a friction, so during intercourse, it's not just touch, it's multiple touches.
And you're saying that it's actually something that is prevalent, it's common.
Way too common.
That's scary,
But Mosullcum as such is not scary, but nobody wants to have it.
No one wants to have it, right? Yeah, exactly. So tell me about the cultural attitudes in India, in the cities, otherwise. Do people hesitate still to come to you to as a doctor to talk about these things? Do they just suffer on their own, self-medicate? What's going on?
Definitely. I think one online consultation has improved this to a great extent.
Interesting.
So earlier, people would rely on this newspaper columns every week, waiting to come, waiting to look at it and check have they discussed some symptom which I may have, kind of a thing, and rely on that. But now people are typing all over Google and they want their problem to be addressed. So even if they are not comfortable visiting a doctor, they would at least send you a request for online consultation. They're okay to share images. So people are more comfortable sharing images than coming to you in person and undressing.
Even now?
Yes, even now.
And that's probably the same for male and female issues, right?
Now with female issues, I would still say that in the last 5-6 years, I've had women more openly coming out and discussing, and maybe comfortable to discuss with a male doctor. But it depends on their comfort level. Many times I referred them to my female colleagues, when they want a female doctor, and rightly so. But even with men. But funny part is, by now I can judge by the body language of the patient in the waiting area and in the room that he's come for an STI.
Oh God, okay. I can understand. I can totally understand,
So, so many times there's a nurse standing with me in the cabin. So the minute we have a patient with an STI, a guy, he's staring at the nurse, like, is she going to leave the room? Then I can speak to the doctor.
They don't want to. They're not comfortable obviously. Still, right?
So I tell my patients, you have the right to privacy. You don't want anyone in the room. That's perfectly fine. I would say we will discuss this problem at your pace, at your understanding. And even men are sometimes shy. They would come with a photograph. Doc, it looks like this.
They don't want to basically
undress.
Fair enough.
Then I try to explain to them, hey, you know what? I can treat you with this photograph if that's okay with you. But if you want me to understand your problem better, or if there's something other lurking around which would help me to understand your problem better, or help you to know if you have more than just one disease. Many people are carrying 2 or 3 STDs simultaneously. Yeah, that does happen. Sometimes puts us in a fix, because we're like, okay, I was thinking it was this. The lab report says it's this as well.
Okay, that's really sad. Yeah.
So that can happen. So many times I think communication helps.
Yeah.
When the patients see that they can discuss their problem with the doctor, and they can open up, then I think that pace builds up, that confidence builds up, and they don't even want to change their doctor. Like, I don't want to narrate the same story or same history to every other doctor I'm going to. So
fair enough. So people are opening up. People are doing more online consultations.
To start with, at least it's the icebreaker kind of a thing. So at least it's the first touch point for people to
feel connected about this topic. Who has more STIs today, generationally? Is there any sort of trend?
You mean to say about
are the younger people getting it, older people getting it?
Definitely. I mean, so definitely people. Always you would have. First of all, there's a surge in the world population. I think all the things that we are seeing, we have to look from the statistical bias of the whole rise in the population numbers itself.
Of that age group also.
Of that age group also. So we were a population of 1 billion in 1960. The world population was 1 billion in 1960. The population has, increased 5 times, 6 times now. So in that also you have this population which is like Indian population, where you have more of the young population, adolescent population. So rightfully, rightly you're going to have the diseases which are going to be there in the young present more, and you will feel, oh, ye itna badh gaya hai.
And with very limited knowledge on this topic, there's a cultural framework, so I can totally understand why the younger folks are having it, right? And in younger folks as well, men and women, similar cases?
Obviously, I would see many more men than women, but they may be a bias over here. But definitely, we have to face this, that men are more adventurous, more seeking out sex out of there. So there are more chances of men having the infection. But not to forget that many a time women at a younger age are exposed to intercourse before men do. Even if you see the legal age, legal age for marriage for women is 18 and for men is 21.
Sure.
So women are exposed to intercourse, or by intercourse extension an STI at an earlier age also. So there are a lot
people
of
are sexually active, right?
So a lot of if you're not talking of LGBTQA I plus group of people, then this man who has an STI is having an intercourse with someone, right?
Correct.
So then obviously for every disease there would be a man and a woman involved. So that's why partner tracing becomes important.
Yeah, very true. Very true. And I know cases where people come and say that they don't even. So if you had a one night stand, for example, and you contracted an STI, you'll go and tell a friend, and this is a real case. A friend of mine was telling me that her friend, this guy, told her that he got it from some girl. But when she said, just tell the girl, he said, I'm not going to go back and do it. This is what is happening, where the other person who spent a night with you doesn't even know that they might potentially have had an infection. So on that note of, experimentation, right? There's a lot of social fabric that has evolved, right, doctor? Right now you have multiple partners, you have usage of sex toys, you have group sex, you have a lot of things which are actually taking place, right? Something that is a personal choice if one wants to, be a part of, an experience of that kind. But what do you do to ultimately prevent getting STIs?
Knowledge, information about all of this is important, and all of it boils down to barrier protection. Okay. And to spell it out, yes, a condom will help. The more interesting part of this extension is everyone knows about condoms and they use condoms, but not many people know about something called tongue-doms or tongue condoms.
Tongue condoms.
Yeah.
Okay. So, what is that?
So it's something like a condom.
Tongue-doms.
Yeah.
Okay.
Something like a condom that can be slipped onto your tongue to protect you while having oral sex.
I was going to come to that next, but interesting. So basically, you get that in India as well? Online
should be available, but for those who can't get hold of tongue-doms, there are dental dams, which are actually, thin sheets of silicone that can be spread over the anal area or over the vaginal area for those who want to indulge in oral sex in these areas.
Okay.
So basically creating a barrier between the mouth and the anus or the vagina, and still you can continue to indulge in oral intercourse.
Okay.
And people who do not again get access to dental dams, all you can do is take a condom, split it open, cut it on one side, spread it into a rectangular sheet, and that's as good as a dental dam.
Dental dam.
DAM.
DAM. Dental
Yes.
dam. Because that I think will be very helpful for the listeners as well.
Definitely. And people who are scared to experiment with a new product, then you have, as I told you, you can just take a condom, cut it sideways,
and put it in your mouth.
No, you don't have to put it in your mouth. So you cut it sideways, make a rectangular sheet out of it, and use that sheet as a dental dam, as a barrier between the mouth and the vagina, clitoris, or the anus.
Got it.
Worst case scenario, I've heard people use cling film. Okay. Obviously, it's not the recommended thing to use because it can easily tear. It's a plastic, very thin plastic, fragile plastic film. Yeah. But if you really are concerned about protection and can't get a condom or a dental dam, then a cling film also is okay, but you need to be careful. Okay. But yeah, so if you can get your hands on
condoms is the way, basically, right? So people need to be aware of these options.
These things are available. Yeah. So why not use them for your benefit?
Yeah. No, that's really great, because I was going to ask about anal sex and oral sex, because people do want to understand how do you protect yourself better with this, right? Now, I want to switch gear to sexual health, and where does it intersect with mental health?
It all starts from there and ends there. Okay. Are you from a science background, or you forget science background? I'm sure in school you've heard something about the cell. The cell has a nucleus. So nucleus is the powerhouse of the head of the mitochondria is the powerhouse. The nucleus is the main control room of the cell, right? Yeah. So same way, the brain is the control room of your body.
So the mind matters a lot.
Mind matters all the time. So even though you're indulging in intercourse at the sexual organ level, the pleasure is felt at the brain level. The endorphins are released in the brain.
Yeah, absolutely. Yeah.
So the erection is triggered by stimuli that is reaching the brain. So everything starts there and ends there. Yeah. So if you're not, happy at a mental level, or you're not, seeking intercourse or sex or sexual pleasure at a mental level, you will not experience it down there, immaterial of what you do. And therefore, it works both ways. It is important to have an adequately satisfied sexual life to be stable and happy out in your mind. And vice versa. You need to have a good, peaceful mind to enjoy good sex.
Yeah, stress-free mind, which is nowadays a big thing, right? That
big ask.
People are very stressed, and it does impact your sexual health as well.
Definitely.
Yeah, that's beautifully shared, Doctor. I loved it. And what about any emerging trends in terms of prevention? I like tandems. I didn't know about that, and dental dams. Tongue-dums and dental dams and things like that, right? So anything else that we should be aware of? Any preventive mechanisms, technology, anything that's there?
You have technology at your hands, so if you have doubts, do Google and at least ask for the basic information, as so that you don't commit something wrong. Obviously, Googling for information may not be the best thing to do, but at least with respect to sexual disease prevention of sexually transmitted infections, you may want to Google. If you're not able to discuss with your friendly neighborhood venereologist or doctor, you could at least Google, discuss with people who know about it, rather than just asking your friend who may not
be an expert,
and may not know, and he'll be like, chalta hai, kind of a thing. So that's one thing that I would want to throw light upon. Apart from that, I think it's just about how people should view this whole concept of sexual intercourse and pleasure. I think they need to be more responsible about their bodies. People say that I don't want to get an STI, and they mean it. And just because they didn't get it with their past 7 partners or 10 partners, it's not that the 11th partner cannot give it to them. So they tend to get casual. They tend to miss out on the protection and concentrate on just the pleasure, rather than the protection.
So, and you always think that it's not going to happen this time, until it actually happens, right?
That's why I tell my patients, कोई label लगा के नहीं आता मुझे HIV है, मेरे साथ कर सकते हो, kind of thing.
No, fair point. So tell me, as we come closer to the end of our really informative conversation, very honestly, on a fairly difficult topic as well, what is the toughest or strangest, craziest case that you've dealt with?
There are n number of
pick one
such cases. One would be to so right from my student days, I had this colleague of mine walk up to me and it's like, Govind, can you please take up this case? This chap is talking about things in his farm and how he manages to take a stool, and he does it with his cows. And animal sex kind of thing. So definitely that chap was suffering with some kind of hypersexuality and a mental disorder that had to be attended to. So, and which my female colleague was not comfortable dealing with. So that's one of my cases.
So you had to handle this case?
Yes, we had to answer and at least rule out the disease point of view, and then treat him from a more psychiatric point of view. So get the psychiatrist involved to try to understand what's happening with this patient. Another case I distinctly remember was again a case on a psychiatric component with this chap was a young boy, I think in his teens. And he was so easily aroused that he said, if I see a woman on the bus, I would ejaculate.
Oh my God, okay.
But
that's a tough life also, right?
So it was not funny, it was rather sad. And it was even tough to get him passed through the examination. So such are the range of cases that we obviously there are various kinds of stories, where men who don't want their wives to know, but they come with their STD reports with their wife, and their wife is asking me what is happening, and I'm like, I don't know what to answer, kind of thing. So these kind of stories.
There is an element of infidelity also that causes
huge element.
In today's society, there's a lot of infidelity.
Huge element.
I had a very strange case where one of my friends' friend had a one-night stand, and the doctor told him that whatever he has can be contracted only from a dead body. And these are the kind of things that are moving around. So there's a lot of need to sort of help yourself in the mind as well. It's access to
information.
It's access to sex.
Okay,
that's leading to all these choices also, unfortunately. Right?
Definitely. I see the whole fact that you can swipe right and swipe left and sleep with someone in the next 10 minutes whom you've never met earlier is the fact that it also brings ease with which you can contract diseases. So when you mentioned about the mind, there's something very interesting which I think your listeners might want to hear. Is from the Indian cultural point of view, there's something called the Dhathu syndrome.
Dhathu.
Dhathu basically refers to dhatus.
The semen.
So semen. But it also dhatus refers to things that you're made up of. So if you read the older Ayurvedic texts like Sushruta Samhita and Charaka Samhita, they talk about 7 different liquids the body has. So there's something called the chyle. Chyle is the liquid of digested food in the small intestine. Then you have the bile. Then you have the blood. You have the flesh. You have the fat. Fat is liquid at body temperature. And you have the bone marrow. Then you have the semen. So these are the 7 liquids that are talked about, and sounds extremely scientific. So some parts of it are probably science of those days. I'm really not sure if I can relate it to modern science, but so it says that your 40 drops of blood makes 1 drop of bone marrow, and 40 drops of bone marrow makes 1 drop of semen. So that's how essential your semen is. So then we used to get, I've now it is reduced, we used to get a lot of these young boys with this syndrome called Dhathu syndrome, which is culturally described in our country, where they feel that, oh, they're having nocturnal emissions, they're ejaculating in sleep, which is normal, but that is making them weaker. That is making them, unable to concentrate at work or at studies. That's making them, depressed, anxious. And that same cycle goes around even after masturbation. The guilt. Okay, they masturbated. There's some guilt associated with it, and they're like, "Oh, there is this. I'm losing semen, so I'm losing energy. I'm losing power." So this is something which is quite interesting, which is noted in our scriptures, and we have seen patients with this. But one thing I would want to tell such patients is, hey, you know what? Don't get scared. You don't need to have a guilt. So I'm not saying that one should masturbate, say, 5 times a day, 3 times a day, 10 times a day. No, anything in excess is not good. But if in moderation, it may help you. It may help you release your sexual frustration and make you feel comfortable in mind.
The mind also.
Yes, and
because there's a lot of stigma against masturbation, right?
Yes.
And there's so much of good information today that it's not wrong.
Yes.
You just need to find a way to moderate everything in life, and don't have these stuck up stigmas that are actually wrong information at the end of the day, right?
So that's what people ask me next. They're like, how much is okay?
Okay.
So it's very tough to answer this.
True.
Because there is no such defined number. We have not done any study where X number of men did it so many times a day and X number of men did it so many times a week, and these were the health issues they had, because multifactorial. But this I learned from our psychiatry professor in college, who had taken a class on sex education. He said, if you're not preoccupied with the thought of sex or masturbation all the time, so if you're sitting in class and so teenagers sitting in class and all you're thinking is, okay, I have to go back home, or I have to go to the toilet, and I have to plan this act, I have to, go to this particular site and use porn, and all that I'm interested in all day is doing that, then probably,
you have a sickness.
Then you have a problem. Or if your habit is affecting your day-to-day life, you should be studying for exams, but all you're doing is this, then definitely there's a problem. And it's okay to discuss, and it's okay to seek
absolutely help. So doctor, I know that before we planned and we started this, there were some facts which sort of stumped us, right? We were quite shocked, talking about it. So let's share it with the audience. Give me facts on this topic.
So actually, when you contacted me for this topic, and I was like, okay, I had not checked stats on paper, So I actually went to the WHO site, and they have said this is 2020 stats, 4 years back, when we were under the lockdown, or maybe getting into the lockdown. So they've said that there are more than 1 million. 1 million is 10 lakh. So 10 lakh curable STIs acquired by individuals between the age of 15 to 49.
Oh my God.
Across the world. Every day.
Every day.
Wow. And this is the non-curable. The non-curable is the bacterial STIs and the simpler STIs. So imagine if you take into account HIV and other viruses, it'll be much more. So
wow. And that's why we're going to have this amazing conversation about prevention of it, because this is the way the number is. It's telling us that
and we are 20% of the world's population.
Correct.
So imagine so 20% of the world's population will be 20% of this numbers if we are having as much sex as the rest of the world.
Wow, 10 lakh a day. That's unbelievable. Thank you for sharing that as well.
Sure.
So if we move to the other effects of, or the other problems that come out of like having an STI, what would they actually be, doctor?
Apart from mental health, I feel it can affect your fertility as well, physical health as well, and especially with women, where and men as well, but with women more so when they have a chronic pelvic inflammatory disease, it can scar their internal reproductive organs, modifying their ability to get pregnant, or the ease with which they get pregnant, or even potential to transmit this STI to their child when they are pregnant. So that is why a lot of STI screening is a part of your pregnancy workups and stuff like that. But it is not uncommon to have infertility in our country because of an STI.
Wow.
Okay.
Wow.
So there are STIs that have caused various forms of issues. So definitely, I mean, say you don't want to have infertility due to a preventable reason.
Yeah. No, that's great. I think this is very good information for people in public to know how important this is, right? And in conclusion, doctor, what is your important advice to all of us, right, in terms of just sexual health?
Sexual health, okay, it is okay to Google, but don't trust everything that's out there. Take your time to discuss your doubts with your trusted doctor or an expert on this. Don't believe everything that's there on porn sites at its face value.
Particularly how you have sex, right?
Yeah, so I mean, say I've had young boys have this weird expectation that they can last for half an hour or an hour just because they saw it on porn. They don't know what's happening out there.
Porn is not reality.
Definitely
I think
not.
Everyone needs to clearly understand. Don't expect men or women to perform in that way that it's being shown, right? Yeah. And it's very hurtful because a lot of people have really suffered because of this. I know people who come and talk about friends, extended friends, they talk about the trauma behind it, that your partner's expecting you to behave like what they saw. But that's probably not how sex is.
Definitely. And most importantly, it's better to be safe than sorry.
Yeah.
And it's now there on a 10-minute door delivery. So use it. I'm saying use protection, use condoms. Better to be safe than sorry. And last but not the least, most importantly, all sex should be consensual. Yeah,
that's great. So on that beautiful note, I want to thank you. And it's been a very informative, very helpful conversation. We've had very interesting things about cleanliness, washing, hygiene, different options beyond condoms, so that you can continue to have a lot of pleasure, but also be very safe about it.
Definitely.
Yeah. Great. Thanks for joining us today, Doctor. And we'll have you back soon. And hopefully our audience like this conversation as well.
Thank you. So reach out to your friendly neighborhood doctor who knows about this so that they can help you if you have any such issues. Take care.